Mood swings, weight gain, fatigue, having problems sleeping at night, or even focusing during the day, and the list can go on and on and on. Obviously, your body's trying to tell you something. Well, January is Thyroid Awareness Month, and joining us right now to talk about this important issue is Dr. Jeffrey Garber, of the American Association of Clinical Endocrinologists, along with Ronni Hochman, one of Dr. Garber's patients. Thank you so much for joining us here in Cleveland.
Thank you.
Thanks for having us.
Dr. Garber, if I may start with you, can you tell our viewers what exactly the thyroid does?
Well, first off, it's a small gland at the base of the neck, and it influences the way your body produces energy and uses it. Put another way, it affects metabolism, which is the way your body converts nutrients into energy. If you don't have enough thyroid hormone, it affects every cell, tissue, and organ in your body, and things slow down. The condition is known as hypothyroidism, or an underactive thyroid. If you have too much, it's known as hyperthyroidism, or a hyperactive thyroid, and things speed up. Examples of symptoms, for example, with hypothyroidism specifically, is you can feel tired, have difficulty concentrating, need to sleep more, be somewhat depressed, cold when others are comfortable, and have sluggish bowels. And the list goes on, and for more details you can go to thyroidawareness.com. That's one word, and it'll give you plenty of information related to this.
Ms. Hochman, unfortunately, do those symptoms sound all too familiar with you? I mean, how did you know when to look at your thyroid?
It actually took a little longer than I would have wished. It was through a process of elimination. I had been to my doctor, and we conducted a couple of procedures to see, if we could narrow down what was causing it. One was a colonoscopy, which came back negative. Other was lactose intolerance testing, which came back negative. So, the positive part about thyroid disease is that it's easily detectable when given the correct blood test, and that's all it would have required, was a simple blood test. So once that was done, I was diagnosed immediately because my levels were extremely low.
So how has your life changed once the proper diagnosis was made? Extremely happy, if I could guess?
Dramatically changed. My system was totally out of whack before, and now it's totally in sync. So in terms of, fatigue, that's become minimal except for, normal life stresses that add into that. But basically, all the symptoms that I had just really went away. And I live a very happy life right now. So it's an easy detection. I would encourage your viewers to go to thyroidawareness.com to learn more, because as Dr. Garber said, they're very basic symptoms that most of us experience all the time. But if it persists, it could very well be the result of a low level of thyroid.
Doctor, we have 10 seconds. Is that why this goes often undiagnosed, because they are just symptoms that it happens every day?
Well put. The trick is, if they persist, they can't be explained. Pursue it.
Thyroidawareness.com. That is the website that everyone should go to. Thank you so much, Dr. and Ms. Hochman, for joining us here in Cleveland, and we hope you have a wonderful day.
Thank you, and you too.